You're in the 2-week wait, analyzing every twinge, cramp, and symptom, wondering is this implantation, an early pregnancy sign, or just your body playing tricks on you? As a mom of 4, I can confidently tell you that some of the earliest pregnancy signs show up way before the test turns positive. Let's finally make sense of what's real. Hi, my name's Ina, a naturopathic doctor with a focus in fertility and a proud mama of 4 after 30. I've lived this journey myself, and now I focus on helping couples boost their fertility and get pregnant naturally. Today we're diving into implantation symptoms and early pregnancy signs so that you can finally make sense of what your body's trying to tell you. Before we talk symptoms, here's the Cliff Notes version of what's actually happening. The fertilized egg is going to travel down the fallopian tube and enter the uterus at 5 days post-ovulation. So the earliest you're going to be feeling implantation signs and symptoms is going to be 6 to 10 days after ovulation, when that egg finally enters and tries to attach to the uterine lining to implant. Some of the more objective signs that you might notice that might clue you into the fact that you might be expecting is light spotting. This happens in about 1/3 of pregnancies, definitely not everyone, and I know a lot of women look for that spotting to happen to confirm the fact that they're pregnant. For me personally, out of my 4 pregnancies, this happened with 2. It does happen. The spotting will be very light, definitely not period-like, probably pink to brown in color. It almost looks like streaks instead of actual bleeding. If you're actually bleeding, probably not your month this month. Other objective signs that you might notice if you have been trying to conceive and have been learning how your body works are changes in your cervical mucus. Your cervical mucus will be more creamy instead of turning towards that drier consistency that you get before a period. This happens because progesterone actually thickens your mucus and increases the amount of secretions that we get. So you are looking for a thicker, creamy, lotion-like consistency, increased amount, and it can almost be a little bit sticky. The other thing you can check is your cervix. If you've been checking your cervix to see when you're ovulating, you would know that the cervix actually tilts forward and opens when it is time for your ovulation to allow for the sperm to enter and meet its egg. When that happens, the cervix turns soft like the consistency of your cheek. However, once ovulation is finished, the cervix will come back up and closes. And if there is no pregnancy, it will turn hard, like the consistency of your nose. However, if you know that the cervix moved back after it was tilted forward and the consistency remains soft like that of your cheek, there's a good chance that you may be pregnant. Another thing that we track when we try to get pregnant is our body temperature. If you notice that your temperature remains elevated after you've had your ovulation, or if you notice that famous dip and then rise in temperature, and it remains consistently high about 12 to 14 days after ovulation, that is one of the surest signs that you're pregnant. Have you been experiencing sudden fatigue? Progesterone spikes after implantation can knock you out. So if you need a nap at 2 p.m. for no reason at all, pay attention, you may be pregnant. And one in this section is breast changes. Breast changes are real, especially if this is your first pregnancy. Increased soreness, tenderness, tingling, darkness of areolas, and visible veins, which actually happen about 3 to 5 days after implantation, can all clue you into the fact that you may be pregnant. With my first child, my breast got so tender that it was impossible to wear anything. Everything hurt. We're going to move on to more general signs that may also point to the fact that you're pregnant. But because these are so non-specific and can often mimic pregnancy symptoms, they're hard to take on their own. However, when you combine them with other signs so that there's more of them, your chances are pretty good. Your appetite changes very suddenly, where you become super ravenous, or on the other hand, completely don't want to eat anything. And then things that you loved all of a sudden seem horrible. Heightened sensitivity, and this can be not only to foods, but also to smells, to lights, and motion. Nausea. Yes, even this early. Bloating, constipation, dizziness can all point to the fact that you might be pregnant. Also, emotional shifts. If you find yourself crying at commercials, being awfully irritable, or extremely calm, are all normal. But the surest way to know is to take an at-home pregnancy test 14 days after ovulation or on the day of your missed period using first morning urine. What's not an implantation symptom? If you're experiencing severe cramps, heavy bleeding, fever, or pain on one side that just won't go away, these need medical attention. Don't ignore them. Thanks for spending a few minutes with me today. If you're on a fertility journey, you don't have to do it alone. I'm here to help you understand your body and feel empowered every step of the way. See you in the next one.